Thank you all for joining us this afternoon. My name is Kathy Roth-Duquet, and I am the CEO and co-founder of Blue Star Families. Blue Star Families is a national nonprofit dedicated to supporting active duty members, Guard and Reserve, veterans, and their families of all ranks and services. I'm joined today by Matt Boren, the Executive Director of ADC. Welcome, Matt. Can you kick us off and explain a little bit about CMSI?
Sure, thanks, Kathy. So only a week ago, ADC and Blue Star Families got together and we said there's a lot of confusion out there, a lot of different groups trying to support defense communities and military families. And there's a real need for us to get these folks together to make sure we're addressing it as a team and that we're speaking with one voice. And that's really what this initiative is all about. So it's great. Thank you all for joining today. This is really just a part of an entire series of initiatives that we're putting together. There'll be a newsletter, a special daily publication that will be heading out today. It is the first edition, and you all will be receiving that here in the next few hours. This daily publication will provide comprehensive coverage of the crisis and specifically how it's impacting defense communities, defense industry, and military families. And then today we're hosting the third of our virtual town hall events, which have been very popular and I think have been able to answer a lot of questions out there and to help clear up some confusion and dispel some notions. So, and then on Monday, we'll be launching a brand new website. And that will be explained in the newsletter you receive. And this is really meant to be a repository of all of the different resources we're collecting. You'll be able to see the town halls through video links, and you'll be able to connect with others across the country that are sharing your concerns and sharing best practices. So, and I just, one more thing, I'd like to thank our sponsors, the Military Housing Association and the Association of Military Banks of America. With that, Kathy, I'll turn back to you.
You can't hear anybody?
Oh, I apologize.
Kathy, are you on? Oh, okay.
Yeah. I'm very excited to produce our pain point poll that Blue Star Families has put out in conjunction with the CMSI initiative. So far, we've had over 1,321 respondents across the country, as you can see in this map. 88% of the respondents from this poll were military family members, 14% veteran family members, and some of the top line surveys we'd like to share. 46% of respondents or their spouses have lost their job, are unable to work, or have had to reduce their hours as a result of this crisis. 21% of respondents with PCS orders are currently or will in the next 60 days be paying 2 mortgages or rent payments. 14% cannot access special education or support services for their special needs child. 12% cannot maintain continuity of care for mental health or behavioral health. 11% are paying for childcare while the provider is closed. 8% are unable to afford 1 week of food. 6% are food insecure because they cannot access school-based food programs. 6% do not currently have housing due to delayed PCS, and 5% are unable to make their basic rent or utility payment. So we'll continue to update this poll. It's continually being asked. We'll ask those of you involved with us on this call to help push it out as well. Now it's my honor to introduce Jenny Korn of the White House. Jenny Korn is the Deputy Assistant to the President, Principal Deputy Director with the Office of Public Liaison. Jenny champions the voices of Americans on issues that affect their daily lives. Throughout her distinguished 20-year career, she's advised officials in government, politics, communications, and on policy campaigns, ensuring that the needs of Americans are heard. She's eager to speak with everyone today about the efforts already underway from the White House as we all adjust to this new environment. Jenny, thank you so much for joining us today.
Thank you,
I have a
Kathy.
question.
That's great. Go ahead.
Thank you. It means so much to us to have you. We know how very busy you are. We have a question already that came in that seemed to me perfect to kick you off, which is this. What efforts is the White House taking to help the country during this COVID-19 pandemic? And how is it specifically keeping military families in mind? So thank you, Jenny.
Sure. Thank you, Kathy, and good afternoon to everybody on the call, all my fellow military families, and if there's service members on here. I just want to thank Kathy, Blue Star Families Association of Defense Communities, for putting these regular calls on. I understand you have upwards of 3,000 participants on these calls from across the country and probably internationally as well. So I just say hello to you. That's a long title that Kathy just said. Again, my name is Jenny Korn. I work in the White House Office of Public Liaison. We are the front door to the White House. We are the liaison for the president to all communities in the country, which includes our wonderful military families. And I am a fellow military family member myself. My husband served 21 years in the Marine Corps, so I understand the life from boot camp to active duty to combat to then transitioning out. And so I just want to thank you for the service that you do for our country as well. And I know what the sacrifices that you are making. You're already serving your country as military family members. And I just know that another uncertainty, this coronavirus, on top of the already ever-changing lives you lead, can be very tough and may lead to anxiety. But please know that the whole country is in this together. Our office works with many constituencies, whether it's small business owners, farmers, minorities, faith, education, veterans, and of course yourselves. And no matter, it's a huge country. We're finding out very quickly as we get thousands of emails and requests and questions. But no matter which category you are in, the federal government has asked us all as Americans to join together to fight this virus. And so I just felt like I needed to really say that to you all, knowing that we have an eye, or we're keeping you all in mind. I wanted to give just an update as Kathy asked me, what are we doing? You know, the president and vice president have held daily press conferences to keep Americans up to date on the latest on the coronavirus and the government's efforts. I don't expect that you guys will all watch each day. They can take upwards of an hour to an hour and a half. But we are now in day 12 of the guidance to 15 days to stop the spread. If you have followed Dr. Birx or Dr. Fauci, who are on the coronavirus task force with the president, they urge everyone to keep following these guidelines the next 3 days, to social distance, to wash your hands, to keep surfaces clean, to stay home if you're sick, to keep separate, even if you're in the same house with someone who may be infected. And we have the full guidelines. If you don't know what they are, Kathy, we can send them to you. It's a one-pager of all the things you need to do. And I learned very quickly about even washing your hands that 20 seconds is actually a long time. You have to sing happy birthday twice. And I do it out loud in order to keep my hands clean. But it's a lot. It's a lot to keep your hands clean. But Dr. Birx tells us she washes her hands about 20 to 30 times a day. It seems like something simple, but it is something that's so important, and to not touch your face. These are just some of the few things on the guidelines. And of course, not every state is the same. So please make sure you're adhering to the guidelines of the state and city that you live in, because the guidelines may differ depending on where you live and what is happening, the current situation of the virus in your different areas. So I wanted to just give you just a few hours ago or an hour ago, the House passed the legislation that is what you probably all care about, is how is the government helping me? The government has asked us to stay home and not work and not have our children go to school and do all of these things. So how is the government helping me? So it has passed the Senate yesterday, passed the House today, and it is on its way to the president's desk this afternoon for signing. And I just want to let you know what it includes. So the massive $2.2 trillion relief package includes job retention loans for small businesses with loan forgiveness available for businesses that keep their workers on the payroll. Direct cash payments, I think this is very important for everybody here. Direct cash payments will be available to American citizens earning less than $99,000 per year, and for couples up to $150,000 a year, with $500 for every child. So giving up to a typical family of four, 3,400 direct cash payments to you. Expanded unemployment benefits for those who have lost their jobs. The average worker who has lost his or her job will receive 100% of their salary for up to a full 4 months. I think that that is very important because this affects all of you, whether you're military families or not. $3.5 billion to expand assistance to child care providers and child care benefits to healthcare workers, first responders, and others on the front lines of the crisis. And then critical support for the hardest hit industries with a ban on corporate stock buybacks and tough new safeguards to prevent executive compensation abuse. The president wanted to make sure that middle America was taken care of. Over $100 billion for our amazing doctors, nurses, and hospitals. $45 billion for the disaster relief fund, more than doubling the amount available. And I'll send these numbers to Kathy too. This is a lot of numbers I'm throwing out at you. $27 billion for the coronavirus response, including $16 billion to build up the strategic national stockpile with critical supplies, including masks, respirators, and all types of pharmaceuticals, and $1 billion for Defense Production Act procurement, whereas, you know, using the act, but we use it only when necessary. We use it as leverage. And the president has said he's profoundly grateful that both parties came together to provide relief for American workers and families in the hour of need. The other thing is tax day. Filing your taxes has moved from April 15th to July 15th. Whether you owe money or are receiving tax relief, you don't have to file your taxes until July 15th. Now, if you want to, because you know you're getting a refund, by all means, go ahead and do that. Wanted to talk to you a little bit about, because we're getting into the 15 days ending on Monday, developing new guidelines on social distancing, which the president is working with the doctors. President Trump sent a letter to America's governors describing how we will be using the data that we're collecting on coronavirus to update the existing guidance on social distancing, which will be developed in close coordination with our nation's public health officials and scientists. This is a direct quote from Vice President Pence. We are approaching day 15, and what the president told the governors, that we're going to listen to the very best health experts in the world. We're going to examine that data very carefully, and we'll be presenting this weekend the president a range of recommendations and additional guidance going forward. The president has made it clear that, in his words, he wants to open the country up, but we're going to do that responsibly, and as the president told governors today, we'll do that based on the data. Now, many of you have maybe watched some of the news coverage, and it's very hard to say what's right and what's not right, and we implore you to go to coronavirus.gov to get the most accurate information. That's coronavirus.gov. So in terms of critical medical equipment, as of today, FEMA has shipped over 9 million N95 masks, 20 million face masks, 3.1 million face shields, nearly 6,000 ventilators, 2.6 million gowns, 14.6 million gloves, and they're sending more every day. We are working with a number of suppliers to manufacture ventilators, even while we work with the state leaders to assess not just what ventilators are available in their state hospitals, but what ventilators are available in private hospitals across the state. And governors across the country are doing great work evaluating the full supply of tens of thousands ventilators. And as far as testing, I know there's also lots of questions on testing. On that subject, I'm pleased, this is Vice President, I'm pleased to report that the testing is available in all 50 states. And in partnership with commercial labs across America, this morning, we received word that 552,000 tests have been performed and completed all across the U.S. Abbott Laboratories submitted to the FDA today a request for approval of a point of care test. This would be the kind of test where you can go to your doctor, You can get the test done there at your doctor and have the results in no more than 15 minutes. So they are just working around the clock to try to get things sped up, things easier for you all, more accessible to everybody. Now that's for the whole country. Military focus. It's called the CARES Act, CARES, which just like I said, passed and coming to the desk of the president this afternoon. $340 billion in emergency funding to combat coronavirus outbreak. The Department of Defense, $10.5 billion to address increased healthcare cases for eligible military members, dependents, and retirees, and to procure additional medical equipment, as well as the procurement of physical protective equipment for medical personnel and disease response. And then for the Defense Health Program, the military healthcare system, $1.6 billion for the expansion of military treatment facilities to ensure maximum capacity of the direct care system and to procure expeditionary hospital packages. And as someone who uses still the base for my military care, I'm very glad to know that they are getting the needed equipment and the monies that they need. I'll leave you with just this. Secretary Esper, Secretary of the Department of Defense, just put out a letter today. And if you haven't seen it or reviewed it, I thought there were some important things here. He says, while the situation continues to evolve, I want to assure the force that we will take all necessary measures to protect our people and win this fight. As we aggressively respond to this pandemic, my priorities remain protecting our troops, DoD civilians and their families, safeguarding our national security capabilities, and supporting President Trump's whole of nation response. Now, I know that you guys are affected in a different way with the restrictions in domestic and international travel. So we understand the impact of delaying PCS moves, modifying training exercises, and temporarily closing some installation services. So these decisions are necessary to mitigate risk to you and your families, and while we work to ease the burden on the force as much as possible. I know that for a lot of you, it's still very difficult, especially if your family member was going to be coming home, or you moved already in advance of your family member and now you're separated for an additional 2 months. I just appreciate that, but please know that this is something that we're asking of all Americans, so that we can slow the spread of this, and really the doctors feel very confident that we'll be able to flatten that curve, as they say, so it doesn't spike up, and we flatten the curve, and we're able to really go back to work and go back to America, because we know that we'll come back even better than we were before. So Kathy, again, thank you for letting me share this news. I said a lot of stuff, so I'm happy to share this, and if people want to review it and know what is available to them, because I know also with our military families, we've got a lot of self-employed people, a lot of entrepreneurs, and I want to make sure that they know that the Small Business Administration is available to them for loans and for monies to help them, or if they employ others, to help keep their employees paid, and the fact that they can pay their rent for their businesses and homes.
Wow, thank you so much, Jenny, for the insightful remarks and for the firsthand view of what's going on. It means so much to us, as busy as you are, that you make the time to come in and speak, and knowing that you're a military spouse and that you walk the walk with us is really terrific.
Thank you. I know that everybody's not here Marine Corps, but I just always remember people telling me Semper Gumby, always flexible. Thank you.
Now, more than,
and God bless everybody on this call, and thank you.
Thank you, Jenny. Bye-bye. Well, we are now going to switch over to our early childhood discussion. I know many of the people on this town hall have questions. If you have a question, we'll ask you to submit it through the chat page on the forum. Our panelists will field a few questions as time permits. Any questions that do not get addressed will be downloaded by our team. We'll work to get those answers up onto our website. As we navigate through the information that's frequently changing, we want to make sure we provide the most up-to-date and accurate answers. So please go look to the website for answers to any of those questions and for a recording of this website afterwards. So I'd like to give a few points from our pain point poll on early childhood education. We know that military families are deeply concerned about the impact of the outbreak on their children's education. Thousands of military spouses and service members are now overseeing their children's education from home, and the stress of homeschooling one's children while having to work from home can have an effect. As one Air Force service member wrote in our poll, "I am mission essential and I have an increase in hours, leaving my spouse to manage the change in our children's schooling single-handedly. This is not good for her mental health." To moderate our first panel, I'd like to introduce Patty Barron, Director of Family Readiness at AUSA. Patty has been a longtime supporter of military families and brings a wealth of expertise with her today. Thanks for coming, Patty.
Oh, absolutely, Kathy. Thank you so much. The Association of the United States Army is honored to lead today's webinar, and I congratulate Blue Star families and the Association of Defense Communities for this really important initiative. AUSA is also proud to provide our members with timely information on COVID-19 from the Department of the Army and the Defense Health Agency. And of course, all this information can be found on our website, www.ausa.org, an organization I'm very proud to be a part of. So as you know, the latest DoD profile of the military community tells us that there are over 1,678,000 military children in the active and reserve components. The highest percentage, 37.8%, are between the ages of birth to 5, followed by 6 to 11 years at 31.9%. So we have a young force with very young children at home. As with homes all over the world, learning to keep so many age ranges of kids happy and healthy while confined to our homes can be a daunting task. That is why we begin today with a discussion on early child education and resources. And I am thrilled to state that we have brought to you the very best of the best, just an amazing array of people for this conversation. It's my pleasure to introduce Julia Yeri, Director of Military Family Projects 0 to 3, Sabrina Huda, Project Director, Sesame Workshop, and Carolyn Stevens, Director, Office of Military Family Policy, Department of Defense. Thank you all so much for joining us. And Julia, from 0 to 3, let's start with you.
Thank you so much, Patty, and thank you, ADC and Blue Star families, for the opportunity to join you today. On behalf of 0 to 3, it really is my honor to be a part of this panel, highlighting the needs of our very youngest children. As Ms. Korn stated, we know that our military-connected families are holding on to so much right now. But we also know that infants and children, young children, are always looking, learning through their close caregiving relationships. And these little ones get their cues on how to interpret what's going on, how they should feel through those relationships. The child looks to the parent and asks, "Am I safe? Can I explore my world?" This is true for how little ones interpret external environmental risk factors too, like COVID-19. If a young child remains stressed for a long period of time, it can impact their brain development and their developing capacity for learning how to regulate those big emotions that they have. That's why we stress the importance of caregivers' well-being. In this time when there's so many unknowns, our youngest need parents to continue to provide them with a very secure base, that sense of, "It's okay, my child, you are safe here with me." 0 to 3 has produced many resources that professionals can use to support parents in caring for their young children during these unsettling times. And you'll find, if you look on our website, articles that emphasize the importance of caregiver self-care, how young children borrow their caregiver's sense of calm. This truly is a period of time where if mama and papa ain't happy, nobody's happy. So we really want to provide caregivers the information they need to make sure that they're taking care of themselves. We also want to provide information on how to answer those tough questions little ones can come up with. They really try to stump us, I think. Trauma theory dictates that we answer those questions simply and directly and based on the child's developmental level. And finally, 0 to 3 has lots of ideas on activities that parents can do with their young child and how to think about creating kind of a day's routine, because we know how important those routines are. We hope that caregivers are also able to take a deep breath and remain mindful of the importance of how they are. We hope parents will be able to continue to provide for their youngest children, as well as their older children, that ability to predict what's happening next, emotional attunement, sensitivity, contingent responsiveness, and a sense of calm for the co-regulation that's so important. Not always easy with so much going on. As you can see in front of you, a sampling of some of the resources available right now on our 0 to 3 webpage. Many of these resources were developed just for COVID-19, and we've also developed a new opportunity through our webpage for caregivers and professionals to send in their questions, and we'll tap our vast network of subject matter experts and researchers to help us answer them. Of course, we also have a lot of tried and true resources available, including our app, Babies on the Home Front, specifically designed for military families. And I also want to point your attention to our many resources on mindfulness, really helping both parents and early childhood educators think about how they can bring this sense of calm to themselves and to their little charges. All of these resources, plus many more available on the 0 to 3 website, may be printed and shared with families, and you can also feel free to link to these resources electronically.
Julia, thank you so much. Super appreciate all the information. 0 to 3 is an excellent organization. But now let's go on to Sabrina Huda from Sesame Workshop. Good afternoon, Sabrina.
Hi, Patty. Can you hear me okay?
Yes, you're coming through loud and clear.
Wonderful. And just to echo what Julia said, thank you so much for having Sesame Street here today. You know, Sesame Street, we've been committed to our military and veteran families for over a decade now with our dedicated Sesame Street for Military Families program. But today I wanted to share with everyone on today a new initiative that's not just for our military families, but for all families. And actually, our workshop has come together in the last 3 weeks for a global response on this new initiative that's going to be rolling out. It's called our Caring for Each Other initiative. So Sesame Street, as you know, we've always been trying to be a source of comfort for children and families during difficult times. And we know right now, our families are facing unprecedented uncertainty. Young kids' lives are being turned upside down. Parents and caregivers, to what Julia was saying, you know, are looking for ways to give their children and themselves a sense of stability and what we're calling this new normal. So in response to COVID-19 on March 20th, and you see the slide here with the website, we launched our Caring for Each Other initiative. The website for this is sesamestreet.org, caring, and it was created to support parents, caregivers, and young children as they navigate through this new reality. Here you can find resources to help parents provide comfort, manage anxiety, help create those ongoing routines, foster playful learning at home, and of course, physically and mentally staying healthy. What's really exciting is, you know, of course, we're mostly known for our lovable Muppets, and they're all home, our Muppets. So they're actually calling in and doing little videos at home with their Muppet mommies and daddies, featuring, you know, just messages of love and kindness, keeping the optimism going, playful activities, and virtual play dates as well for your kiddos. What's really exciting is in this time, we've also been working really hard to develop some new content where we'll be adding to this initiative, and that will be launching on March 30th. And we have some time now to really key down on those key messages that we want to get across that we are seeing in this time. Emotional support, of course, being the most important, that as families, we're all in this together. There's lots of ways of comforting one another, simple ways to explain what coronavirus is to young children, and teaching our kids that when you take good care of yourself, like hand washing, you're actually taking care of others as well. Of course, what we're seeing, you know, with all the statistics Kathy even shared earlier, like kids are home and learning continues and needs to continue at home. So we're providing bundled activities of everyday routines with simple activities that can be done. And then, of course, continuing the prevention curriculum that I know so many organizations are stressing: hand washing, ways to stay healthy, coughing and sneezing into your upper sleeve or elbow, not your hands, and practicing everyday healthy habits indoors as well as outdoors. So how are we doing all this, right? With our content, we have to do it in the Sesame Fun way. We've created some new animation videos. They're really catchy. There's going to be a great Washy Wash song featuring Elmo and his dancing chickens, and they're washing their hands with soap and water and singing to this tune, which lasts for 20 seconds. So kiddos can start doing that as well. We also have additional animations to take activities offline. We'll be creating some printables, again, to demonstrate those best practices around prevention, self-care, and emergency response techniques for kids and families to do together. There's parent articles, which are really easy to read articles intended for the grown-ups, providing some tips and talking points to offer comfort in this new normal. And of course, a continuation of these learn at home pieces that we believe are really needed right now, with these bundles to assist with one's learning at home. And these bundles will include around topics such as routines, play, reading, math, brain building activities, and of course, physical movement as well. And additionally, just wanted to highlight, on Monday, we'll also have a partner toolkit. And thank you for switching the slide over. That's perfect. So a social media toolkit will be provided for all of our partners. And for, I wanted to include our email here, so anyone who's interested in receiving that can reach out. And that's going to basically have customized posts to share on social channels along with just messages of positivity. And Patty, I just had to share that, there's so much going on, so much uncertainty, but Sesame Street for Military Families is very committed to celebrating Month of the Military Child. We're gearing up next week. We've adapted all our activities to be remote, and we're including fun and creative activities for families to do together at home, and we'll be posting almost daily on our Facebook page. So all that information is here. We urge families to please follow us just for a little bit of lightness and fun during their day. And any questions anyone has, my contact information is there too at militaryfamilies@sesame.org. Thanks, Patty.
Sabrina, thank you so much. It makes me happy just hearing about all of that. And I'm going to really try to learn the Washy Wash song because that'll be fun. And now let's go on to the Office of the Secretary of Defense. And I'd like to introduce again Carolyn Stevens. Carolyn?
Thanks, Patty. I'm excited to see the Elmo song about hand washing. I will take a minute. So first of all, thank you very much for allowing me to participate in this panel. And we really appreciate an opportunity to talk about some resources that are available for not only our military families, but all families. And I will echo some of the remarks that we've been hearing this afternoon, how important it is to take care of ourselves, to take care of each other, how important it is to have consistency and routines, not only for our children, but for the adults that are in that caregiving role. So what I would like to do is first share a research-based parenting program that's been developed by the staff at Penn State University. It's available at no cost, available online. Our slides got in a little bit late, so I will hopefully be able to have the slides shared when this is archived. So the program I'm talking about is called Thrive, and available at Thrive, THRIVE.PSU. Oh, there it is. Great. PSU.edu. Super. Thank you. And the Thrive program offers parents strategies designed to help strengthen positive parenting skills, to help them manage stress, not only in themselves, but also in their children. The Thrive program has resources that help promote a healthy lifestyle, how to include children in daily tasks like cooking and laundry, how to stay active when you're indoors. And what I find most helpful are the segments that look at a scenario from both a child's perspective and a parent's perspective. So when you go into the Thrive program, you'll notice that you have opportunities to choose an age group, 0 to 3, 3 to 5, 5 to 10, and future content will be available for those middle and high school ages. So if you are the parent of a 3-year-old and you're struggling with early morning routines and getting your 3-year-old up and ready for breakfast, and you face those frustrating scenarios, Thrive offers an opportunity to see the scenario from both the child's perspective and what he or she may be thinking because of their developmental age and stage, and how you as a parent are viewing the scenario and how you might have some reflection and how to see things in a little different light and perhaps lessen some of the frustration that you might be feeling in some of those scenarios when you're home together. I do want to go quickly, shifting gears a bit and talk about our primary resource for information. So if you will go to the next slide, please. And I think as many of you know, Military OneSource is our authoritative and vetted online source for information. And the slide that you see in front of you right now is a slide that depicts all of the resources that are available for families. You can go online to Military OneSource to the About Us section, and you'll find that this slide becomes interactive, and you can find out a little more information about each of these different resources that are available to our families. And while our website is called Military OneSource, I do want to stress that very much of the content is available to everyone on the public-facing website. That's just another way of saying it's free. So much like Thrive is available and is free to you, many of the resources available on Military OneSource are free as well. If you'll go to the next slide, please. This is a slide that we've developed that specifically looks at COVID-19 resources. This information is updated on a daily basis. Here's a list of some of the resources that are available at that website. There's much, much more that really can't be displayed in this particular slide. So I'd encourage you to go to the web address that's listed at the top of the slide for some more resources. And of course, the slide also mentions our counselors. So for those of you that are struggling with anxiety, frustration, or just need someone to talk to, we do have counselors that are available. Of course, given social distancing, face-to-face counseling is something that is not happening at most of our locations, but you have the ability to talk to counselors through online chats and through telephone. So we are there to help you. We've got specialty consultants who are trained to work with our families who have a family member with special needs. We have specialty consultants who are there to talk to new military parents as well. And then the last slide, again, is just showing you some of the other resources that are available through Military OneSource. Some of these resources do require login, do have eligibility requirements, but you'll notice for those of you who do have access behind the login, I'll draw your attention to the digital library. There are some great books and activities and resources there for children. So if you're not able to get out, because you're not able to get out and get to a library, here's a good resource that may help you keep up that daily routine of reading to your children. There are products available to our military families, things like baby wheels, and many of the products that have been developed by Sesame Workshop. They've been a great partner to us over the years. So thank you again for the opportunity to share some of the resources. And Patty, I'll turn it back over to you.
Carolyn, thank you so much. We've got a limited amount of time, and so I'm going to turn it back over to Kathy to see if there were any questions from the audience.
Thanks, Patty. Here's one. What are your suggestions for caregivers parenting alone now through a deployment and unable to use childcare or community supports due to social distancing? How do they practice self-care?
So anyone want to try that one? Carolyn? You all might be on mute if you're trying to talk. I'm not sure what happened to the audio, Kathy, so let me turn it right back to you so you could start. Oh, I'm sorry.
This is Julia. I just thought I'd throw in that we do have some things on our website that speak to that, and it's so tough, especially with the worry about their loved one, and then the parent is trying to manage everything on their own. So we do have some ideas on practicing self-care, and also just doing things like making sure that you're having quiet time, even for the older kids, so that you can take some time to have a break, a time out for yourself. It's not selfish to practice self-care. Your kids need that from you. And so finding ways to work that in are critically important. So I just wanted to offer that little bit for those who are trying to do it as a single parent, whether it's because of a separation or because they are single parents and they're trying to do it by themselves. Hopefully that's helpful.
That's very helpful. Thank you, Julia. All right, Kathy, back to you.
Great. We have time for just one more. What are your recommendations for families with special needs? What resources are available? Does Thrive have help for special need kiddos?
This is Carolyn. I'm back. I'm so sorry I could hear you, but I couldn't answer you. Yes, I think you'll find that the Thrive website will offer good advice and good strategies for all parents. We believe very strongly in inclusion, and so I think you'll find that an important resource. I would also encourage you to sign up for the Exceptional Advocate newsletter that's available through Military OneSource. That's a way to stay connected to resources beyond what's happening in this moment.
That's great. And just a quick one, because I think I know the answer for all of you. Are your resources available to Coast Guard families?
This is Carolyn, yes.
Yes, this is Julia, yes.
And yes, this is Sabrina Sesame. Definitely yes.
That's wonderful. Well, thank you to the panel, and thank you, Patty. Did you want to close it off? And then.
Thank you, Kathy. I'm just so proud of everyone on the panel. You bring such enormous information to our audience, but with exceptional expertise. And thank you for saying yes when we put out the call. You guys are fantastic.
Great. Thank you. And thank you, Patty. It was a great discussion. And I want to thank Patty Barron for her leadership in organizing this entire town hall. It couldn't have happened without you. Next, we're going to talk about the impact of COVID-19 on childcare. Again, I'd like to highlight this discussion by highlighting the childcare challenges identified by our Pain Points poll. In the best of time, finding affordable childcare is an enormous struggle for military families, we know, especially if they live off post. The current crisis has made things worse. 17% of our Pain Point polls respondents indicated that they were unable to use their normal childcare provider. 11% told us they were still being required to pay for childcare that they can no longer use. As one Army spouse put it, I am teleworking from home and still have to pay for childcare. My child is at home with me for the foreseeable future, and his daycare still wants to charge tuition despite the crisis. The daycare is off post because there aren't enough slots available at the CDC. 7% of our respondents reported that they or their spouse have reduced their work hours because they can't obtain childcare. So our next panel will discuss how we can best support childcare during this COVID-19 crisis. So for this, I'd like to introduce Barbara Thompson, who will be moderating this panel. Barbara is the former director of the Office of Military Family Readiness Policy. In that role, Barbara was responsible for programs and policies that promote military families' well-being, readiness, and quality of life. Throughout Barbara's long career, she has been and remains a major advocate for innovative child care development programs. She is a special friend to Blue Star families and many of the organizations on this call today. Thanks for joining us, Barbara.
Thank you, Kathy. And again, I'd like to echo everyone's thanks to ADC and Blue Star families for hosting opportunities such as this to address those important relevant topics for the defense community. We know that childcare is essential for working parents. And for the Department of Defense, mission readiness depends on childcare. However, the dilemma facing the DoD and really the nation, is how do we provide childcare that protects children, staff, and their families when we know young children exchange secretions and are most likely not able to perform adequate hand hygiene or cough etiquette, no matter how many times their teachers and parents remind them and model these practices themselves. The decision to close schools did not come easily. And while, even though an afterthought, leaders finally recognized early childhood settings present unique and dangerous challenges for infection control due to caring for a highly vulnerable population, there is close interpersonal contact. Think diapering, feeding, bottles, and diapering is very close between children and adults. And of course, shared toys and other objects. Under the best of circumstances, transmission of infectious diseases cannot be completely prevented in childcare. And as a result of this highly contagious virus, due diligence must be considered so young children do not bring infectious diseases back to their homes and infect their family members, especially leaving service members vulnerable to the COVID-19. This panel, and I'm so excited to introduce you to them, will address how the industry and particular programs have adapted to address these needs and concerns. We have Dr. Lynette Fraga, she's the Executive Director, Child Care Aware of America, who will share what we are learning from the private sector. Next, Ray Gurn, Higher Ground Education, will share how the Guidepost Montessori schools have retooled their mission. Charlie Williams, Chief Operating Officer and Chief Programs Officer for the Armed Forces YMCA, will address what his organization is doing for DoD families. And we thank Carolyn again to be on the second part of the panel to talk about how the DoD is responding to the child care needs. So Lynette, I'll turn it over to you.
Thank you, Barbara. Thank you so very much. And again, I also want to share my gratitudes for the invitation to be on the call today and for everyone that's listening for all that you do every day as well. So this afternoon, I look forward to sharing a little bit about Child Care Aware of America and the work that we're doing right now as we face the challenges of this pandemic. Child Care Aware of America is a national membership nonprofit organization that works with state and local child care resource and referral agencies and other community partners to ensure that all families, each and every family, has access to quality, affordable child care. And we do this by providing technical assistance to child care professionals and advocate for child care policies that improve the lives of children and families. We are also so very proud to partner with the service branches and the Department of Defense to provide child care assistance for military and DoD families through the Fee Assistance and Respite Child Care programs. We have served more than 10 million families and created a network of more than 10,000 licensed child care providers. As many of you know from personal experience, working parents across the country are scrambling to find alternative childcare arrangements as schools and some childcare providers have closed, much of what the picture that Barbara painted at the outset. This crisis has demonstrated just how essential childcare is. Many of us on the phone and many of those that have spoken, we've created partnerships with over the years, already knew that, how essential childcare is, and certainly parents and those that advocate for childcare knew and know how essential childcare is. And in this moment, it certainly does enable healthcare workers and emergency responders and essential military personnel to stay on the job. I would like to briefly share how we are supporting childcare providers and leveraging public policy to help the childcare system during this national emergency. Our emergency preparedness team is providing technical assistance to childcare resource and referral agencies and childcare providers across the country through webinars and downloadable resources. And we're also collecting stories from the field and sharing these stories with policymakers to advocate for more impactful assistance to help providers weather this crisis. And I'll just make a comment about both what Barbara shared as well as the comment that Kathy shared earlier about the struggles that parents are experiencing and similarly the struggles that providers are experiencing about how to provide care and how to be on the receiving end of care what providers can do and what they're struggling to do in order to ensure that they are supporting those individuals who are at the front line. And I would say for child care providers who are providing that care, they too are on the front line. Absent their ability to be able to provide safe and nurturing care for our early emergency responders and for our essential personnel, for our healthcare workers, those individuals would not be able to do their job in taking care of all of us. So Child Care Aware of America, in partnership with many organizations, as was shared earlier by Ms. Korn, has been urging Congress to provide significant and dedicated funding for child care programs during this crisis. Right before we started this call, as was shared, in its latest federal stimulus package, Congress has passed the stimulus package CARE, of which $3.5 billion will be a down payment, if distributed quickly, to provide the much needed help to the child care system in the short term. Importantly, not only so that we can have a child care system today, but so that we can have a child care system when the economy comes back online. In particularly, we know that this financial support can make a difference for child care resource and referral agencies, of whom we are a membership organization of, who are working each and every day to ensure across the country that families can have access to emergency care for essential workers and for healthcare providers, and that the child care providers who are weighing this decision to close or to stay open, keeping in mind all that Barbara shared about the sanitation procedures, the health procedures, the impact on their families and their spaces and places, weighing that decision can be difficult. And we're trying to help those providers navigate that system, as well as helping parents to make educated and informed choices. And the childcare system that is adapting really rapidly to a changing situation. Recovering from this pandemic will not happen without the support of the federal government for the childcare industry and the additional funding that's necessary with the challenges that we're seeing out and about across the country, which include everything from ensuring that childcare providers have the sanitation materials and equipment that they need to ensure that children are safe, to ensuring that childcare providers who've had to close down, in fact, have the resources necessary to do that effectively. And again, on the other side, are able to open back up. Or when childcare providers are able to stay open, that they have the resources and supports, both public health, and systemic, that they can provide effective and quality care for the children that they serve and the families that they want to support. We have heard firsthand from childcare providers and parents across the country that they're looking for information and resources to mitigate the challenges posed by this crisis. And we've compiled and are frequently updating the latest coronavirus resources in one central place, and you can find that at childcareaware.org. Some of the things you can find on that website is a state-by-state map with the latest information around coronavirus and childcare available in each state, including closures. An interactive map of childcare needs for essential workers during the coronavirus outbreak is also available. This map was actually developed by two Yale professors, Dr. Walter Gilliam and Dr. Eli Fenichel of Yale, and both of them came together and created this amazing map, which you can also find on our website. We also have up on our website a resource hub with coronavirus resources for parents and providers and policymakers from trusted sources, including some of you on the phone. A Share Your Story page is also available, so you can share with us how the crisis is affecting you, your family, and your community. As I mentioned earlier, and as Barbara even asked me to share, these stories and understandings about what's happening across the country is so incredibly important, so we can rapidly respond and amplify some of the concerns and challenges, as well as some of the innovations that have occurred across the country. You can also directly contact, of course, your members of Congress and so forth to make sure that, that we are responding to the crisis effectively. We are continuing as Child Care Aware of America to support families during this crisis through our Child Care Fee Assistance Program. And again, additional information about our fee assistance program for military families is available on our website. And finally, you've heard me mention Child Care Resource and Referral Agencies several times. These individual agencies and communities, there are over 400 of them, may have different names, but they can help you find emergency childcare options that may be available in your community. And you can also search for those organizations on our website as well at childcareaware.org. I hope you and your family stay safe and healthy, and we certainly do stand ready to help you during this challenging time. Thank you again for inviting me to participate on this webinar, and I appreciate us talking about the importance of early childhood.
Thanks so much, Lynette. And Ray, I'm going to turn it over to you.
Thank you, Barbara, thank you everyone for your service and your courage and for coming together. We're a school operator and a child care operator. We have 47 schools across the country, and so we've obviously been kind of hit pretty hard and have had to understand, how do we want to respond? And so I'll just speak quickly about, 3 things that we've done in response. First, in terms of our 3,500 existing families, we have put in place immediately something we call a family framework, just to give that support with respect to kind of what has to happen at home. And our unique view of it is there are actually a lot of resources, incredible resources available. What's needed is a plan. What's needed is the ability to carve out an hour on Sunday night and plan for the week, and supporting that development of a plan. We have parent concierges to really embed these individual particular resources within an overall methodology and a framework and a work cycle, and having the routines, having the repetition, understanding the children in addition to needing care and in addition to needing the adults in their lives to be calm, need their developmental needs met. Their development does not pause for a virus, and they need meaningful work. Children have a radar for make work or filler and can sense that you're just trying to keep them busy. And so, how do you involve them in your life? The first thing is this family framework, immediately supporting people that have their children at home, which we're going to now extend out as a resource to others. Not just our network. The second thing is really we call it guideposts at home. It's actually placing some of our educators, some of our providers, our caregivers, and nannies in people's homes in small groups, to the extent that the guidance is such that we're allowed, and it's kind of advised to do that. And generally, from a regulatory perspective, we've gotten a lot of support across the country to implement this, so that our not only our teachers and caregivers can find meaningful work, but others out there that are looking for work can find it, and that we can really optimize for maximal social distancing and for all of the best practices that we know are critical. The third thing that we've done is really launched an initiative to provide at our 47 closed facilities and at pop-up facilities, essential care for emergency workers, emergency care for essential workers. I'm of the view, I think we're all of the view that, childcare, while it's an odd space to be a mission critical sector to, kind of fight a global pandemic, that's the reality. This is not, South Korea or Singapore, where you can, for, $100 a month, get somebody to come in and live in your house. The people that are going to be doing the work, including all of you, to kind of, whether it's first responders, whether it's hospice workers at nursing homes, the people that have to do that work cannot do it. This problem has to be solved, and I think the need is there. I think that there's people that are looking to contribute and do meaningful work in a safe way. The work staff is there, the facilities are there, the regulatory accommodations are there. What's needed is an operator. What's needed are operators stepping up to the challenge, figuring out the logistics, figuring out in particular how to train people very quickly and ramp them up, how to support them, and get these programs implemented where they're needed fast. And so we have just mobilized everything to do that. You can go to guidepostmontessori.com, and if there's a need and you're an essential worker, if you're in a situation where you need childcare, we understand that we as an organization and we as a sector have to provide that. It's too critical. We have a special emphasis on the psychological needs of the child, not just the physical need for childcare, but on understanding that parents of children that are essential workers that are in critical workforces need to know that their children are okay. Not just that they have someone babysitting them. They need to know that they're okay and that their needs are being met, so that they can, psychologically as well as physically be present for the kind of great work that they have to do. And similarly for parents at home with their children, there is a need to, as others have talked about, manage your own energy, plan, and really see this a little, see this as a, hopefully it's not, but to see it as a marathon and not a sprint, and recognize that, it's the clickbaity one activity here or there is not going to solve the problem. There's some work that has to be put in and kind of help people do that work. I'll stop there. And appreciate again the opportunity, and would love to carry on the conversation one-on-one if you have any ideas for how we can be supportive and involved.
Thanks, Ray. Really appreciate that. Charlie?
Hey, thanks very much, Barbara. And I'll start by echoing everybody else's thanks for including us in this topic here today in this discussion. Armed Services YMCA is very happy to participate, and also very proud to be one of the organizations working this challenge for all of our currently serving members throughout the military. I'd like to start this conversation by quickly summing up what we were doing prior to COVID-19 in terms of childcare, and then talk about what we're doing today and what we might be able to do in the future. Just real quick, the childcare programs we have offered in a combination of 9 different states and 6 different time zones are everything from before and after school care to a full day care CDC environment to a drop-off daycare, and also even in military treatment facilities, a program called Children's Waiting Room, where spouses are able to drop off their little ones with us while they go and take care of their own medical appointments and medical needs at the military treatment facility. So, like everybody else, we started seeing these challenges come up a couple of weeks ago, especially in first as the schools started closing. It really, to remind everybody, this coincided with spring break in many of our locations across the country. So some of our before and after school programs were already on a week's break because of the spring break going on wherever they were. That only continued, and as I think everybody else has seen, we have now seen virtually all of our before and after school programs curtailed until we get past this COVID-19 crisis. What that has done, really, I think it's manifested itself in terms of the family's ability to maintain a second income if that second income was in fact still available. That also was a result of several CDCs having a reduced throughput in children come in as parents found themselves at home, and our own CDC started seeing a decreased population coming in for regular care. I think as a result of both of those factors, as parents have been
I just lost sound.
In several different locations. So what we are looking at moving forward, I'd like to focus on several sites that they are experiencing or moving forward in 2 different ways. First of all, our children's waiting rooms are remaining open in most of our locations. A couple of the spots, the hospital has actually asked them to close because they're simply not allowing any children to come into the hospital until COVID-19 has passed us. So in those cases, we're not able to maintain that children's waiting room and the drop-off daycare in the hospital. But what we are doing in several of those spots is responding to requests from local installations or the local military treatment facility and establishing a either full day care or drop-off care that will be provided for the hospital personnel and essential personnel at the installation. At each of these locations, they have similar challenges. in COVID-19. We are now faced with trying to provide care in rooms limiting to, most often has been 10 individuals. That will be 9 children and one instructor, one facilitator. So the capacity challenge is going to be there throughout this environment. And we're going to continue to explore ways where we can open those facilities and be able to provide care for the essential personnel. We're also looking at, beyond the medical teams, being able to do the same thing for personnel located at the installations. And in a couple of locations, we'll be able to do that as well. And finally, we're also increasing our ability and capacity to deliver that emergent food assistance. I'd highlight a program in San Diego.
May have lost Charlie, Barbara.
Yeah, I lost him too. So maybe you can, Carolyn, can you jump in now?
I sure can.
Okay, thanks.
I think the issue that's facing all of our childcare programs, both in the community and for military programs, is essentially a universal problem. How do we support essential personnel, mission critical personnel for our military members, while maintaining a safe environment for children, a safe environment for the staff members who are taking care of them. And because of that, that's why we're seeing programs having to make these very tough decisions where they're assessing both local conditions, conditions dictated by state governments, guidelines from the Centers for Disease Control, taking all of that into account and making these really, really hard decisions. And so if you are the parent of a service member or a defense civilian who's been declared mission critical, there's a possibility that childcare is available for you. But it's important to know that within the Department of Defense, installation commanders are given the authority to make decisions about what's best for their programs based on the local situation. And so that does mean that across the Department of Defense, the operation level of a child development center on the installation may look different in one location than another. So throughout the Department of Defense, some of our programs are closed completely. Some of our programs are open only to those mission essential personnel. Some are open, but open for limited hours. Programs have declined to offer part-day preschool, for example, because they're really focused on trying as best they can to support the working families. All that's to say that it is very challenging. It's challenging for the programs offering care. It's challenging for families who may not be able to access care because of these conditions. So we encourage families, once again, I'm going to tout Military OneSource. We encourage families to go to Military OneSource for current information about COVID-19. We encourage you to stay in touch with what's happening at your local installation. And I think that is the best place to go for information that is the most current and the most accurate. Barbara, back to you.
Thanks, Carolyn. And I don't know if Charlie is back or not. We lost you to finish up your session.
I am back, Barbara, and I apologize.
Okay.
I'm not sure what happened, and I have no idea where I dropped off.
I think you were talking about a food program in San Diego.
And Charlie, if I
Okay.
could ask you to go through that quickly, because we do have a lot of questions and I'd like to be able to get to some of them.
Yeah, actually, the part where I was talking about the food program in San Diego was towards the end of my discussion anyway, as long as I highlighted the programs where we were trying to establish a drop-off and full daycare for several installations where they've asked us to in a couple of hospitals. That would be the bulk of my input. So I think I had almost completed, Kathy. Thank you.
Okay, Kathy, over to you.
Great. Thank you so much, Barbara. And for our panel, we do have lots of questions. So I want to see if we can get through a few of them before we drop off. Here is one for childcare aware. How will COVID-19 distancing requirements affect military family subsidies? Our center isn't closed, but we kept a child home in accordance with CDC guidelines and still had to pay to save the spot. So will they still get their subsidy?
That's such a great question. And unfortunately, I'm going to have to, and hopefully we can respond as we receive additional guidance on the subsidy, but I will sort of pull it up a little bit in terms of all families across the country. This is not only an issue as it relates to military families, but all families. Because some governors, some communities, some cities, et cetera, are getting guidance to close down childcare centers, there is a challenge on both sides. So parents, to this parent's question, may need to continue to pay, and providers are asked to shut down. And how do we bring these two together, particular whether or not you receive whatever kind of subsidy you may receive for your program? I know that policies are challenging right now as we try and sort of consider how we best make providers whole by ensuring that they have the resources to continue on with their agency or business or childcare program. Similarly, how do we ensure parents are made whole by ensuring that that they're receiving the kind of dollars that they need at such a critical time when income is challenged? So I think that's a great question, and one I think that many on several levels are grappling with to ensure that families and providers are both supported through this challenging time. And Carolyn, you may have an additional response.
Okay, and I was going to say we do have the ability to post answers on the website afterwards if we want to come back.
Fantastic.
Well. Carolyn, before you answer that one, I have another one for you so I can put them together and maybe you can answer both.
Okay.
Our child care center at our base is closed to us. It's only open to essential personnel, but in order to subscribe to a child care center in town, we have to unsubscribe to the CDC, and therefore we would lose our place once the center reopens. What can we do about that?
So we've recently become aware of that issue and have passed that down to the service level. So one of the challenges, I think, I don't want to sound like I'm not answering the question, but we do rely on our services to operate their programs, and we always appreciate becoming aware of concerns that our families have. And so we are, with the services, taking a look at this so that we don't put our families in an untenable position. I'm reiterating what everyone's been saying. I think this applies to the question about having to pay for childcare to hold your space. We are just in an unprecedented situation. We are struggling and working to try to get answers for our families as quickly as possible. And so I think this question also falls into that umbrella. And certainly I will follow back up with that.
Thank you. And I think some of you touched on this. This will be the last question we'll ask before we wrap up, but what are your suggestions to military families who need childcare, but CDCs are closed? Mom is a nurse and dad is an essential military member. Any suggestions for that family?
So this is Lynette. The first response I would have is that you can go to childcareaware.org and visit the map that is available on our website, which goes state by state, and it's now color coded, which can tell you what those states are doing as it relates to childcare openings and closings. So that's helpful information. And you can also search for your child care resource and referral agency in your location. And they will have real-time information, particularly for emergency responders and essential personnel, about where they can find emergency care. And you can find that information again on childcareaware.org.
That's great. Barbara, I'll turn it over to you to close. Oh, sorry.
Sorry, Barbara, this is just
Go
Ray.
ahead,
I would
Ray.
just add, if there's 4, 5, 6 families of essential workers and you want to just create pop-up care, if there's a high school student that is ready to step in, in a home, and you just need an infrastructure, you just need a kind of framework in order to implement that and make sure that you are, practicing the practices. That is exactly what, we hope to launch by next Monday. So guidepostmontessori.com. Obviously, if there's an existing center near you, that's the immediate need. But if there's a need to have something set up quickly, and whether there's existing staff or there's a need for sourcing a caregiver as well, we're hoping to really offer assistance to that.
Ray, we can take that information and put a link on our site for that as well, for pop-up daycare. I love that term.
Sure.
Yeah. Okay. Barbara, back to you.
Yeah, this is great. I really do appreciate the expertise and the commitment of our panelists to share what they're doing within their own organizations to meet the child care needs of military families. As Carolyn said, these are unprecedented times, and we have to think very much out of the box. But at the same time, my closing remarks we need to protect our children, our staff, and our families. That's the number one issue. So how we do that is going to be challenging, but gosh, we have the best experts available to make those decisions. So thank you all very much.
And thank you, Barbara, for helping to lead this panel, and for all of our panelists for their efforts today. We greatly appreciate all the work all of you do. For those on the call, please take a moment to complete the post-event survey, which you'll receive by mail after this town hall, so we can plan our future events. And now, to close out the discussion, I'd like to invite Matt from ADC to join in again and tell you about our upcoming virtual events and resources. Matt?
Thanks, Kathy. And if all of you are like me, I was furiously scribbling down all of these websites and resources. But I promise you we will get this up on our joint website so you can visit all of these great organizations and see what they have to offer. Next week, we're going to be diving into 2 really relevant topics. One that was mentioned a bit on today's call, and that's what's in the stimulus package that was just passed in Congress today. There were several provisions mentioned today which have to deal with military families, installations, and how communities interact with their bases on a wide range of issues. So we'll be doing a deep dive into that, and then frankly we'll be asking what's not in there, what's not in that package that needs to be. As Congress looks to debate the next stimulus package, how can this community communicate its needs to that discussion? And then following that, later in the week, we'll have a more robust conversation on how COVID-19 is impacting our defense industrial base and causing disruptions in the supply chain. So I hope you'll all be able to join us. You'll see more about that here in the coming days. And thank you all again to the panelists.